So I am here today to try to show you how can health economics helps decision-making in reproductive health, particularly in the SDG 3 Target 7, and particularly for Caribbean countries. So, by starting, from my point of view, health economics is the area of economics worried about how to produce health efficiently and how to distribute health equitably. So if we want to apply this analysis to reproductive health, of course we have to find the most efficient ways to reach reproductive health objectives, and we have to answer what can we do for assuring equitable distribution of those reproductive health objectives, of those outcomes. And going directly to the SDG 3 Target 7, you know, we have two indicators, two official indicators for measuring our advancements toward this SDG. And the first one is the proportion of women of reproductive age who have their need for family planning satisfied with modern contraceptive methods. And the second one is the adolescent birth rate. Here you can see Caribbean countries in orange, Latin American and the Caribbean as a whole region in brown, in color brown, and the rest of developing regions in color blue. In a simple analysis, you can see that our countries are, or your countries are head and shoulder above the rest in terms of these indicators. What does it mean? It means that it will be harder each day to conquest an expansion in the coverage of modern contraceptives. I mean, to reach the SDG 3 Target 7 in terms of this particular indicator will be really hard, and it will be really hard to persuade international donors to spend in our countries in order to help us to reach this indicator, this goal. And in a certain point, it reached an acceleration, and after a new point, it starts to leveling off, and it will be harder to get more advancements. And this third point, in which a third phase, the higher modern contraceptive prevalence rate starts, and in which will be harder to get conquest, to get more advancement, starts around 50% of prevalence. And as you can see in this chart, most of Caribbean countries are in the higher part of this curve. This last curve is the same that I showed you, but it includes only the Latin American and Caribbean countries. As you can see, we are showing here the last part, the third phase of this curve with S-shaped curve, you know. And as you can see there are only 5 countries in our region that are still in the second phase, a phase which we can call increasing marginal returns. The most important thing from my point of view here is the huge differences, the gaps that we register among countries here. You know, we have countries like Jamaica, which are in the best situation, and we have countries like Guyana or well, you can see here particularly Guyana and Belize, which are registering higher levels of adolescent birth rate. But in this case, we can suspect that will be easiest to persuade not only donors, international donors, but also governments to invest in preventing unintended adolescent pregnancies. But what can the health economics do to help this advocacy? Let me show you the toolkit of health economics assessment. From my point of view, it is like an onion. As you know, we have layers of analysis, and as long as we are going to the center of this onion, we're getting closer to the best evidence-based decision. $1 that we spend in contraceptions generates savings in the order of 1.47 in attending this pregnancy. In the current phase of the construction of reproductive rights, conquests do not depend on innovation, on medical innovation, or on technology innovation, but in our ability to persuade governments to adopt the right political decision, and incorporating tools and arguments provided by the health economics to the rights approach can be useful for advocacy. Thank you.